Hello, my name is Winnie Hanidu. I'm a student nurse right here, and today we'll be performing a physical assessment on my patient. My student number is 13600831. Here's my badge, and we'll be 360. Here's my patient, and here's my equipment: my stethoscope, pen light, gloves, sanitizer, and more. I'm now going to set the camera. Okay. While I get myself ready, I'm just going to ask my patient a few questions and tell him more about this session we're having. So, hello, Mr. Rex. Today we'll be doing a physical assessment. I'll be putting on my sanitizer and wiping my stethoscope with alcohol, putting on my gloves. So, yes, again, hello, Mr. Rex. Today we'll be doing a physical assessment here. Yep. I'm sure you know that. Just want to let you know I am Whitney, your nurse who's going to be helping you here. Okay. So, if I can get your consent to this session. Sure. Thank you. Sure. Do you need any water? Anything to go to the washroom?
I'm good.
All right, he's good. Ready to go. So we're going to close our curtains and get started. We're going to start with a general survey. From what I can see, we're going to look at the physical appearance. We got the odor. There's no odor. He looks appropriate to his age, and the skin is uniform. We're going to look at his body contour. His position upright. He has good posture. There's no deformities or dysymmetry. Everything's symmetrical. He does not look malnutrition. Can you please stand up for me just so I can see? His body proportion is appropriate to the age. Please sit down. Thank you so much. We'll look at his behavioral skills. From what I can see, he's cooperating. He is making eye contact. He looks, his mood is good. His facial expression is not in distress. He is talking. He has no slurred speech or anything. Now I'm just going to mention his workout breathing. As we can see, there's no accessory use of muscles or heaving. And now we're just going to check his LOC and orientation for his LOC. From what we can see, he is alert ×3. And his orientation, Mr. Rex, can you please tell us where we are?
Oh, again, my room.
And?
Whatever.
And the time, please. What time is it?
It's 11. I think 12 past 11.
All right, thank you so much. Yeah. All right, so we just finished the general survey. Now we're going to continue. We're going to go into the physical assessment and go from head to toe, go over the face, the thorax, and the abdomen, and more. As I inspect, there's no discoloration or deceivingness of the hair. I'm just going to quickly palpate. Do you please tell me if you feel any tenderness? No. All right, as I palpate, I don't feel masses, lesions, bumps, or bruises, and his head is normal cephalic. Now I'm going to move on to the face. As you can expect, the skin does look uniform. There's no discoloration, scars. Everything does look symmetrical, and as I look, the hairs of his eyelashes and eyelids do look evenly distributed. His nose is midline. I am going to investigate further with the lips and ears as we go on, but for now, I'm just going to inspect the eyes. I'm going to look closely. Can you please look at me, Rex? All right, so from what I can see, the sclera is white. There's no lid lag, there's no ptosis. His eye pupils are symmetrical. There's no discharge, and I'm gonna check this. I'm gonna check his conjunctiva real quick. So, Mr. Rex, can you please look up? And I'm gonna pull his eyes down. The conjunctiva is light pink and normal. Again, with the symmetry, the eyebrows, the eyelids. I'm going to quickly check the eye, the ocular motor nerve, which is cranial nerve number 3. I'm going to use my stethoscope. My pen light. I'm going to quickly measure the pupil, which is 33 millimeters. 3 millimeters, which is a normal. I'm going to do the consensual light reflex as well as direct. Mr. Rex, I just need you to look close right at me and keep your gaze right on me. Okay. I can see he's giving me his gaze. There's no twitching in the eyes. All right, go shine a pen light on you. All right, so I'm checking both eyes. And as I shine the light on his eyes, both pupils constrict. Now I'm gonna try the consensual. We'll cover one eye if you don't mind. All right, both eyes are constricting. All right, now I'm gonna test for accommodation. Mr. Rex, can you please look at this pen light? I'm gonna push it closer to you. As I see this, the eyes converge, and there's no twitching the eye. I'm gonna pull it back. All right, so from my findings, the eyes dilate and constrict when looking close and far away. I am now going to inspect the nose. From just what I can see, it's midline. I'm gonna put your head up, please. Yes, the hairs are there are hairs in the nose. The mucosa is pink. There's no drainage or polyps or anything like that. I'm gonna check for nose patency. Mr. Rest, just breathe in and breathe out, and I'll cover one nostril each time. Breathe in, breathe out, breathe in, breathe out. All right, and now I am going to check the lips. As we can see, the lips are moisturized. They're appropriate to the color. They are symmetrical, and they look healthy. We'll check them out soon, but before then, I'm gonna quickly check the ears. As I inspect the ears, there's no massive lesions or scars or bruising. I'm palpating the tragus, anti-helix, helix, and antitragus on both sides. Everything seems well. And I'm going to check the mouth real quick soon, but before then, can we do the facial expression? We're going to do the facial expression test, or just the facial nerve. So Ms. Rice, keep the smile, frown, shut your eyes. Oh, okay. Puff your cheeks. Then we're going to check for resistance. All right, and it's there. All right, so now I'm going to check for the glossopharyngeal cranial nerve. All I need you to do is open your mouth, head up, and I'm going to look at the uvula. I don't see any, the soft palate as well, and I don't see any infection or tonsillitis. And can you please say ah? All right, good job. So as I can see, the soft palate and the uvula are moving accordingly when they say ah. I'm now going to check the hypoglossal cranial nerve. Mr. Rex, can you please take your tongue? Can you please move them left and right? Left and right, thank you. And now please say light, tight, dynamite.
Light, tight, dynamite.
All right, so the hypoglossal cranial nerve is intact. We're gonna move on to his neck. As we can see, there's no deformities. Everything's symmetrical. I'm gonna palpate just for any bumps or tenderness. And you feel any pain? No tenderness? Yeah, the neck is midline and symmetrical. I'm gonna palpate for the carotid artery just under the mandibular. So the carotid arteries, I do feel the pulse. The rhythm is regular. The pulse is a 2. And I'm just going to check the other side. All right, I'm going to quickly check the rate. I would wait for about a minute, and once I get my number, the number is 86, which is normal. I'm going to do the range of motion. All right, so can you please look left and right, if you can, up, down. All right, thank you. Now we're gonna check for resistance. I'm gonna put my hand right here. Can you push towards while it's wrong? Okay, as well. And we did that. Okay, so we just did the neck, and everything's okay. We don't see limited range of motion, no cryptis or any pain as he moves. We're gonna move into the tegumentaris system, which is the skin. Just from inspection, there's no scars, lesions. Skin is uniform. Skin is healthy. It's moisturized. There's elasticity. Just to make sure, I'm going to check the skin torque. I'm going to pinch your skin. Pinches go back to place, therefore the elasticity is present. I'm going to quickly palpate and see if there's any bumps, lesions, masses, or any, we're also going to check the muscular system as well. And I'm going to check for any joint inflammation. All right. No inflammation, no pain, nothing bulging out, no deformities, no muscle atrophy. As I can see, he does have bulk. He is strong. Just to make sure of that, can you please pinch my 2 fingers here as tight as you can? He's super strong and capable. Everything's well. Like I said, there's no deformities. As I can see, his muscle has bulk. All joints are present. I'm going to quickly check the apical pulse, the radial pulse. I will wait for 30 seconds and multiply by 2, and I get 86. Also, the rhythm is regular, and the strength is 2+, which is normal. All right, now we're going to move on to thorax. The thorax, just by inspection, there's no deformities, there's nothing sticking out, no muscle atrophy. The ribs are going downwards, we have the intercostal space. There's no use of accessory muscles or anything. I'm going to palpate, and it's also take the back and the front. So I'm going to quickly palpate. Breathe in and breathe out for me. Thank you. Breathe in, breathe out. All right, so there's nothing sticking out. There's no deformities or asymmetry. Asymmetry. Breathe in, breathe out. All right. I don't feel any thrills, which is probably supposed to do with the heart, but there's no heaving, there's no wheezing. And now I'm going to also take both back and front and tell you my findings. I'm going to the diaphragm. I'm going to wipe with alcohol salt once more. And blow on it so it can warm up. So that's all I need you to do is breathe in and breathe out. I'm going to start from on the neck area and work my way down using the Z track. Please breathe in and breathe out. 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 The other sides. Up, arm up. Breathe in and breathe out. Breathe in and breathe out. Other side. Breathe in and breathe out. Breathe in and breathe out. I'm going to also do the back real quick using the Z-track once again. Breathe in and breathe out. 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 All right, so for my assessment, there's no adventurous sounds. There's no wheezing, heaving, or crackling. I did find the brachial, vestibular, and the mix of both sounds found in the thorax, which is the brachial sounds are found around the neck of the larynx. It's loud and hollow, where the vestibular, which is around the peripheral side of the lungs, are soft and glowing like a tree. The mixture of both is in the sternum. Again, the breathing was fine. I didn't see any force of labor or any abnormal sounds, and he is healthy to go. And now I'm going to check the I'm also going to check the cardiovascular system, which is the heart. I'm going to go in and auscultate for the 5 valves of the heart. First, by using the reference points, starting from the sternal notch, going down to the angle of Louis, and palpating for the second intercostal space. Alright, we found that. I'm going to use my bell. So for the right side, to the right side of the sternum, I'm going to palpate around the second intercostal space, which is the aortic valve. Alright, sounds good. I'm going to go over to the left side and auscultate the pulmonic valve on the second intercostal space on the right side, on the left side actually. Now I'll go to the third intercostal space on the left side. I have the Erb's point, and then the fourth intercostal space with the tricuspid closer to the midclavicular line, and the fifth intercostal space, which is the ventral valve, which is closer to the midclavicular line as well. Alright, so I'm going to assess the back as well. Breathe in and breathe out for me. Yep. Alright, for my findings, the heart is normal. It's beating at a regular rate. There's no abnormal sounds like S3 or S4, which is associated with swishing. I did hear the normal sounds of S1 and S2, which is a love dove. I did palpate once again. There's no thrills, which is a sign of abnormal enlargement of the heart. I'm going to quickly assess just for bruit on the carotid, and I don't hear any brewing. All right, we did the heart, and now we're going to do the abdomen. So Mr. Brex, can you please lie down real quick for me? All right. Just if you want, we can do the range of motion of the muscular system. Can you please put your hand up, hand down, stick your leg up and down. All right. Now hold my hands together and squeeze. All right. Thank you. He's strong. Now can you please lay down? All right, so we're going to assess the abdomen real quick. We're going to inspect. The skin is moisturized. The hair is evenly distributed. There's no scar, lesions, or cyanosis, or any discoloration. I'm going to also see real quick and check for hyperactive vital sounds, such as found in the lower right quadrant. As I also say, I'll go in all 4 quadrants. I'll use the bell actually, the bell side of the rub it, breathe, and put breath. So as I also take, I would find the stomach and the spleen on the right side of the upper right. Then I'll find the liver and the appendix side, the liver and the pancreas on the left side, upper right, left side. And the lower right side, I'll find the hyperactive sounds. Then I'll use my bell for that one since it's high pitched. So it's just breathe in, breathe out. Okay. So the bowel sounds are there. Just to check for contour of the abdomen, I'm gonna get my pen light and just look for the shape of the abdomen. And I'm gonna look behind him to see any hernias. Nothing is hurting. And from my conclusion, we are done with the assessment. Mr. Reskin, please get up. All right, we're about to end this. We did well. Everything's okay with you. Doing well, and we'll see you at the next appointment. If you're good to go, please look at the camera and put this thumbs up, please. Bless. Thank you. 14 minutes. Wow.